The practice of medicine has become increasingly standardized and in many cases impersonal. Newer providers are relying heavily on algorithms, smartphone apps, and artificial intelligence in their decision-making. For the elderly patient or family member, this can be all the more confusing because they are not digital natives. When we think about developing treatment plans for our elderly patients, we need to get back to basics. And the basics are what matters. Let's listen in on an emergency room visit with Mr. Akaka, who's complaining of weakness and fatigue. The triage nurse has already been in to review his medications, and he's now meeting with the resident for the visit.
Mr. Akaka, I see that you're taking metformin, allopurinol, lisinopril, atenolol, amitriptyline, Flomax, and omeprazole. Can you tell me how you take these medications? Do you take them on an empty stomach? How many times a day do you take them? How have you been feeling?
Well, I haven't been feeling like myself. I've just been so tired.
Looking at your lab values and vitals, it looks like everything's perfectly controlled.
Yeah, but I feel weak and unsteady. I'm afraid to go out because I just feel like I might fall. I feel so dizzy when I get up at night to use the bathroom.
Yes. Well, that happens when we all get older. It is to be expected.
Oh, okay, I guess you're right. I am turning 80 soon.
A week later, Mr. Akaka is back in the emergency department after having fallen on his way to the bathroom.
Mr. Akaka, we looked at your x-rays and you have a broken hip. We need to perform surgery and we'll need to put a metal rod in your bone.
How long will the recovery be? I'm supposed to visit my grandkids in Las Vegas next month. Will I ever be able to walk again?
Well, there are no guarantees that you will be able to walk again. After your immediate recovery, you will be transferred to a skilled nursing facility for rehabilitation.
How long will I need to stay there? It's very important to me that I can remain at home and take care of myself. I don't want to end up in a nursing home.
The impact of 4 simple words. What matters? What happened to Mr. Akaka is not uncommon. Unfortunately, there are not enough geriatricians to be able to meet the demands. A geriatrician is a provider who specializes in the complex medical and social needs of our most vulnerable population. Having a geriatrician on the treatment team can make a huge difference in a patient's quality of life. Those 4 simple words become the foundation for a conversation with patients, and that allows the treatment team to be able to design an individualized care plan that addresses what's important to the patient and their family. A thorough understanding of what the patient values and what matters to them becomes the foundation for an age-friendly healthcare system. In 2018, the American Geriatric Society estimated that there were 7,000 practicing geriatricians, but only half of those were practicing full-time. In the coming years, we will only have 7,000 geriatricians to address the needs of this growing population. The ideal patient load for a geriatrician is 1 geriatrician to 700 patients, or the equivalent of 3 jumbo jets. In 2025, we are estimated that we will need 35,000 geriatricians to address the needs of 17 million older adults. But we will only have 6,000 geriatricians, which means that only 3 million patients will get the geriatric care that they need. It means that a geriatrician will now be caring for 10 jumbo jets full of patients. What happens to the 14 million patients who don't get the specialized geriatric care that they need? What happens to Mr. Akaka? What happens to our elderly parents? What happens to me and you? In Hawaii, we are even harder hit by this shortage. We already are facing a shortage of primary care providers, and this was only exacerbated by the COVID-19 pandemic. As you can see from the map, our neighbor islands are even harder hit than the main island of Oahu. In Hawaii, We have one geriatrician for 24,000 elderly patients. That means that a geriatrician needs to see one patient every 4 minutes for the entire year, or they need to care for 100 jumbo jets full of patients. The bottom line is we are never going to be able to create enough specialists to meet this need. This is an all hands on deck situation, and we need all the hands and the entire deck to be ready to face this wave that's coming towards us. We need 4 things. We need more geriatric experts, and these are physicians and nurse practitioners with specialized geriatric training, but it's also geriatric pharmacists and geriatric psychologists that create the team that can implement that specialized treatment plan. We need more geriatric training for the entire workforce so that every provider who comes into contact with that elderly patient understands the importance of what matters. We need public education so that our patients and their families can advocate for themselves in those sessions with those providers. And we need health policies to support all of us as we age. But this is easier said than done, especially in Hawaii, where we are geographically separated by ocean and islands. Especially in Hawaii, where our population is so diverse and the nuances between ethnic groups can be difficult to navigate, and where outsiders are not always trusted to provide care. Especially in Hawaii, where our specialty care is located on Oahu, but it's our neighbor islands that have that critical need. Simple questions like, what's important to you today? What brings you joy? What makes life worth living? What are some goals that you have 6 months from now or before your next birthday? These are questions that can elicit what matters. These are questions that would have fundamentally changed the outcome for Mr. Akaka. Let's listen back into that emergency room visit and see how things could have gone differently.
Mr. Akaka, looking at your lab values and vitals, it looks like everything is perfectly controlled. But I hear you when you say you feel unsteady and unsafe. It seems like being independent is important to you. Is that correct?
Yes, I really enjoy my freedom and spending time with the grandkids. They're 15 and 13 now. They grow up so quickly.
Oh, I see. I have a few little ones of my own, and they do grow up fast. I'd like to understand what is important to you. What are some goals you hope to achieve in the next 6 months or before your next birthday? What brings you joy?
I love watching their sporting events, and I'm looking forward to traveling with them next summer. I promise to take them and the family to Disneyland. If I can see them graduate from high school, that would really make me happy.
Thanks for sharing that information with me. I can see you have some plans coming up. There are a few things we can do with your treatment that may help you achieve all of those things. I'd like to make some changes to your medications. Are you okay with that?
Oh, okay. That sounds good. What do you have in mind, Doc?
Well, you may not need all of the medications, and some of them can make you dizzy or tired. I'll talk to your pharmacist about your medications, and I'll also refer you to physical therapy to get you stronger.
Yes, I'd like that. Sometimes it's hard to remember to take all of those medications. Getting harder to remember things lately. My daughter has to remind me often.
Well, we can also check on your memory too if you would like.
What matters? The words, simple. The impact, profound. Understanding and acting on what matters makes the difference between a positive and negative health outcome. For Mr. Akaka, it makes a huge difference in the quality of his life. We've essentially given him the gift of time. He can live independently, living out his golden years, spending time with his grandchildren, and creating lifelong memories. And what could matter more than that?